Wait, 6. Okay. Okay, there you go. Kitty.
Frontal bone. Parietal bones. Temporal bone. Occipital bone. The sutures. Corneal suture separates the frontal from the parietals. Sagittal suture separates the parietals. Squamous suture separates the temporal from the parietal. Lambdoid suture separates occipital from the parietals. Going to the front, this is the mandible, or lower jaw. This hole is a mental foramen. You have the maxilla bone. These ridges along the tooth line are the alveolar process. Nasal bone. Vomer separates the nasal cavity. Zygomatic bone is your cheekbone. Inside of the orbital, you have the lacrimal bone, which is right here, this structure. And then right here is the ethmoid. This is the glabella, the depression in between the eyebrow ridge. This hole here is the supraorbital foramen, right there. This hole right here is the inferior orbital foramen. On the lateral, we have the coronoid process, mandibular condyle, right here, mastoid process, styloid process. Where the condyle sits is the mandibular fossa, right there, that depression. This bone that starts here, goes down underneath the zygomatic, down through here, back up to this zygomatic is your sphenoid. Looking at the skull inferiorly, you have your palatine bone right here. Going through the teeth on the lower jaw, you have your incisors, you have your canine, your premolars, your molars. Back to inferior, occipital. This is the external occipital protuberance, it's a bump. Foramen magnum, the large hole your spinal cord goes through. Occipital condyles, where your first vertebrae allows your head to turn and pivot. Here's the jugular foramen. And in front of that, anteriorly, is your carotid canal. Looking at the skull superiorly, we have the crystal gale, which is this triangular bone here. The cribriform palate is on either side. That's where your olfactory bulb sits, so when you smell, take in molecules through your nasal cavity. They go up here, and that's how your brain detects smell. The structure that sits in the sphenoid bone right here is the sella turcica, the Turkish saddle. And that's it, except for the optic canal that sits right back in there, in the back of the orbital. And that would be it.
Thank you.